own health, but the health of the country. So the challenge that the government faces is always trying to put in place measures that will account for this kind of thinking and this kind of behavior. We spend a lot of time trying to bring on board the Jamaican society so that we all recognize that if we act responsibly, if we take faith in the guidelines issued by the government, and take faith as well that the government is listening to you, the government is not trying to act in any particular special interest. The government is acting in the national interest. Indeed, the government is acting in your interest. So once that is rooted and cemented in the minds of the people, then it makes our job that much easier. So we did very well, as I had said before, in having almost a month since the first case, keeping the numbers very low, extremely low. But one incident occurred, which is now under investigation, and there is a whole process around that. The result of that is that that one incident has yielded more cases than what previously existed. In other words, the entire island had, up until the outbreak, somewhere around 73, 75, don't quote me on the exact number. And now we are at 223, of which I believe about 122, of which 122 are from that single workplace. So you see the kind of infectiousness of the disease that we're dealing with. And I hope that the average Jamaican listening, the Jamaican who would say, nobody can tell me if it's on me yard. You know that Jamaican. That Jamaican who say, I've passed through tougher than this and I've survived. That Jamaican who say, a little white rum and some bush tea and I'm good. I'm hoping that also the Jamaican that say, well, I can't stay home and suffer, so even if I'm going to get the disease, may as well I get the disease. I'm hoping that those kinds of thinking will be dispensed with, will be put away, and a greater reasoning, a better reasoning, will come into effect for all our citizens. It is a real struggle for the cabinet to put together the measures. There is no one set of perfect measures, meaning there is no set of measures where everyone will feel that they have won. We try as best as we can. There is no set of measures that do not require of every single citizen some sacrifice. So what is it that we're trying to maximize with the measures? Well, firstly, those persons who are most at risk from dying from the disease, we want to protect them. And we know who these persons are. They are persons over 65 by the clinical profile of the effects of the disease. They are persons who have comorbidities, especially those who have multiple comorbidities, meaning that they have other illnesses. And Jamaica's health profile is such that non-communicable diseases are prevalent in our society, particularly your diabetes, some people say sugar, hypertension, high blood pressure, heart problems. So these highly prevalent diseases in our society, and with the age profile, would place a significant number of Jamaicans in that high-risk category. So strategy number one for the government is to ensure that that high-risk category stays out of harm's way. So it's the orders that are designed specifically, that speak specifically to those populations, are the orders that say if you're over 70, if you have comorbidities, if you are working and you have these kinds of illnesses, diseases, but even if you have them under control, still stay at home, stay indoors. We do make provisions for those elderly persons over 70 to come out once per day to get the essentials of life and go back in. But for your own protection and health, you should try as much as possible to stay away from the general population. Now, the government has also taken some other measures, which the Minister of Local Government had announced earlier. Golden age homes, infirmaries, there are certain orders that relate to them. Those orders still remain in place, particularly about visiting and how workers should operate and the hygiene measures that are necessary. So we want to make sure strategy number one is to protect our elderly. So far, knock on wood, we have done fairly well in protecting the elderly population. And those, of course, with the high prevalent comorbidities. The second strategy is to have a very efficient and responsive surveillance system. So the entire public health system is on alert to pick up whenever we see a case comes to our attention, whether it turns up in a hospital, in a health center, or someone calls in. And I believe that the success that we have had to date is primarily due to the agility and high functioning of our public health services. And today, again, it can't be said too much. When we say public health services, we tend to specify doctors and nurses. We tend not to speak about the public health inspectors and those persons who do the contact tracing and who are really on the front line going out interviewing persons. And I want to today big them up and say, we recognize what you're doing and we salute you and we appreciate what you have done. So that system has worked very well along with the testing protocols. And I do know, I interview a few of the persons who work in the system. I interface with them, I talk with them. They explain to me what their job is. And I do know that they are out there on the front line. They're being sent all over the country, tracking down and tracing, interviewing. And it is a skill. It is a real skill to get people to cooperate and to disclose where they have been and who they have been in contact with, and then to do the matrix and make the connections. And as a result of that, we have been able to capture most of the cases. In fact, a significant number of the cases. In addition to that, those cases that have turned up in the system on their own, we have, as the minister said, the sentinel sites. Those are the sites where people would, if they feel ill, they would just go. And we have tested all those cases. And those cases give a very good indication of what is happening with the spread of the disease in the wider society. So if you find that people are turning up outside of your contact tracing, then it is a signal, it is a sign that the disease is generally coming up in the population now, and you could say it is community spread. I am not going to say that as yet. I'll allow the CMO and the epidemiologists to say whether or not we are in community spread. But it is signaling that the virus is out and about, abroad, generally in the community. That means you could walk past someone and pick up the virus. That means you could be standing in line at the supermarket and pick up the virus. Indeed, I don't have permission from the health personnel to say this, but I'm going to say it in a general way for shock value, but it is true that one of the persons who was picked up as a close contact, when the public health officials made contact with the person, they were standing in line at a supermarket. answered their phone, and it was a public health official asking them, "Where are you?" "I'm in a supermarket." That is what is happening. So that is telling you that it is generally out there, and you have to be careful. So where we are now is that the Minister of Health and his team, in terms of another strategy, in the sense that we have done as much as we can in terms of our contact tracing and identifying. You have heard the minister say we have done contact tracing for 500 or more of the 700 plus workers. 600, you have done contact tracing for 600 plus of the 700 plus workers in that workplace. But a better measure would be to ensure that those who we have done the contact tracing on, those who we have knowledge of, that instead of having them generally quarantined in the area, it is better to have them quarantined together where there can be better administration and supervision and better analysis of what is happening with the outbreak in that cluster. So as the minister pointed out, they have taken a decision to move the affected population into quarantine. It is, I think, an excellent decision because it takes the burden off the Portmore community, the Linstead community, the St. Catherine community in general. Because as we would have seen, it is next to impossible to have a perfectly running curfew order, stay-at-home order, no movement order in the parish of St. Catherine. So having them in the parish heightens the risk of persons actually getting being infected with the virus. Nevertheless, we don't have all of them, and we don't know all the contacts that they would have made. So there is still a risk. So in the management of the risk, last week, this time, we decided to impose enhanced curfew measures on the parish of St. Catherine. Those enhanced measures were difficult for us to do because from the outset, we knew how difficult it would have been for a parish like St. Catherine, where you could easily say, I'm not speaking from statistical knowledge, but just anecdotally, maybe half of the working population of Kingston and St. Andrew lives in Portmore and St. Catherine generally. And you could almost say that 2/3 of the essential services workers live and commute live in St. Catherine and commute into Kingston and St. Andrew. So it was always a difficult task. But we calculated the risk and felt it was better to have done it. Why? Because though the measure has come under some criticism, and we understand why, my job is to explain the logic, and sometimes the logic escapes the criticism. So whilst we are not able to totally use, and I hesitate in using the term lockdown because there's no lockdown, but we were able to prevent people from going into Portmore. And I think that is half of the benefit. Since we can't prevent people totally from coming out, if there is a population moving in and you can stop that, I believe we have effectively stopped that in terms of a risk management. We have been effective as well in limiting the movement from St. Catherine into other parishes. There are a few areas which are not manned, and I have spoken with the Commissioner of Police to ensure that we step up those measures to ensure that there is a tighter restriction on movement out of the parish. The challenge, of course, with putting on the measure is that everybody wants to be exempted. And I know everybody is important, everybody's job is important, but the purpose of the measure is to stop movement. The virus doesn't have legs. It depends on us moving, and the more we move, the greater the probability of spreading the virus. So there is no absolute stopping of measure, but stopping of movement measure. But what you want to do is to manage the risk, and so you put in place measures that will have a large impact on movement. What happened in Portmore in particular, Spanish Town and Linstead to a lesser degree, was a defeat of that purpose on the days where movement was allowed. We have done some recalibration, which I will explain later on, to enhance the effectiveness of the measure. The other strategy that we employ in managing the epidemic is to manage movement generally in the society. And what we have done is to put in place general curfews. And again, I must commend the police and citizens in general for the high level of compliance regarding the national all-island curfews. Those have worked exceptionally well, and they have served to limit unnecessary movement. By 9 o'clock, the roads are generally clear. When it was 8 o'clock, generally the roads are clear. During the Easter, when we had more enhanced measures, generally the roads were clear. So I think Jamaicans have done well in that regard, and that gives me hope, and I think every Jamaican can take hope that we can follow some of these measures without complaint and without any form of disobedience. Now, those measures, as I've said, work. We have put in place other measures, such as the gathering rules. The gathering rules have been particularly difficult to implement because of how they are being interpreted. So supermarkets, for example, some supermarkets say they're only allowing in 10 at a time. The way in which the orders are structured, supermarkets are not exempt from following the social distancing rules. They are not exempt from the gathering rules, but they have to exercise certain latitude in how they allow in customers. So the idea is that if they have to come into the space, that you should put up what is called physical distancing markers. And you should insist that people stand, and we have done some amendments here, 6 feet apart within the space, and you should make a judgment on the number of persons within the space so that the number doesn't breach the 6 feet space for each person. And that's easy math for persons to do, and that should be a good guide as to how many you can let in at a time. And you also want to move people in and out quickly. So for people who have to shop, people who have to move about, you want to get in and move about. Leisurely shopping, window shopping in this time, not recommended. And indeed, the supermarkets and other public service agencies should try as best as possible to move people in and out. Now, we've also tried to encourage businesses to move their services online. What was clear on Saturday was that persons had to stand in long lines to get remittances. And it is not just remittances, it's to go generally with these measures to pay electricity bills, to pay utilities. Many of these services can be done online. And I want to encourage every single Jamaican who has a bank account, who has a card attached to that account, if you are not now using online services, and if you have never used it and you don't know how to use it, asked for advice, call the bank and let them explain to you how it is done. Now is the time to get online in every sense of the word. Get on the internet and get online with the measures that we are putting in place. The truth is that if all Jamaicans were banked, that is, that they had a bank account, then there would be no need, absolutely no need to go to a physical place to collect your money. And indeed, if all Jamaicans were digitally provisioned, meaning that they had a facility to go online and there were financial technology solutions that could allow for widespread payments, then there would be no need for many of the lines that we're seeing. So a part of this COVID epidemic is the transition of the society to a digital society. Indeed, hopefully, this will be one of the long-lasting changes that would result from this crisis. So all of those are measures that we have put in place, and I've given the explanation as to why we have those measures. So as of today, we're making some changes to the orders, and I wish to announce them now. Educational institutions are to remain closed up to the 31st of May 2020. I want to be clear, I'm not saying that there will be no school. The physical place of learning, the school, will remain closed, but education will continue online or remotely. So they will remain closed until May 31st, 2020. Our borders will remain closed to the 31st of May 2020. However, this will be subject to controlled re-entry of Jamaicans in accordance with established protocols. Previously, when we closed the border, we allowed limited re-entry via a discretionary application through to the Minister of National Security and then the approval of Cabinet. Now we will have a protocol in place. The protocol has been established, and that protocol will control the re-entry of Jamaicans. And here let me say that I am very sympathetic to the case of the Jamaicans overseas. I get a report almost daily from your Minister of Foreign Affairs, and I'm going to ask her, when I'm through with these measures, to come up and give an update. There are some who are more vocal than others, and I may see their case because they are more vocal than others. But I want every single Jamaican to understand that there are thousands of Jamaicans stranded all over the world, some of them in extreme hardship, not just financially, but psychologically and emotionally as well, being apart from their home. Jamaica is not the only country that has adopted strict border controls. Within the Caribbean, there are several countries, within CARICOM especially, who have taken that position. And it is for good reason. But my sympathy is with them, but more than sympathy, we have put in place a protocol. It would have to be discussed publicly, obviously. We will bring it to Parliament. And as soon as we can, we will start to have controlled re-entry. All BPOs are to be closed for a period of 14 days, starting at 1 second past midnight, or rather 1 second past midnight on the appropriate way to say it, AG, help me. It's Wednesday. Wednesday. So commencing on Wednesday. So on Wednesday, and Wednesday start at 1 second past midnight Tuesday. So from Wednesday, so they have 24 hours, basically 24 hours notice, to close their operations for a period of 14 days. Now, I want the country to understand that this was not an easy decision. The same people who will tell you that you must close the BPO are the same people who will quarrel with you and say people who used to work in the BPO are starving and you're not providing for them. Again, there is no easy solution. Closing the BPOs either is not a simple or absolute action unless you intended to close them for good and forever, because these operations are not meant to be closed. They are meant to give you 24-hour stand-up services through hurricane, natural disaster, catastrophe. That is how they are designed. So, for example, they have critical systems that can't go down because these servers serve critical industry and infrastructure that Jamaicans depend on. Many of them provide support to logistics and shipping that brings the food into our country. Many of them support the telecommunications and banking industry that were those to go down, then you would not only see the lines of people who can't get their funds at the remittance office, you would also see those who stayed at home trying to get their money online quarreling with you. So the issue of closure then is that we have said to the BPOs that the critical services, those that support the telecommunications, the banking, and the logistics and shipping, particularly those related to our operations as a country, that we will make exemptions and provisions for their operations, but those will be closely regulated. In fact, we are going to appoint one of our agencies along with the Ministry of Health to closely examine those minimum operations, because we don't want that minimum operation to be used as a guise for full operation. I am heartened by the level of proactivity that I see within the Business Process Industry Association. They have already started to plan, indeed many of them expected that this move would have occurred, and they have moved close to 13,000 of their workers to work from home. And the government earlier had made a provision to allow BPOs to move their equipment from the workplace to the place of home. And so many of our BPOs had already taken advantage of that. It is not easy on them. There are significant costs, but I believe everybody understands that this has to be done. This measure has some public health considerations as well. Consider if there were to be another outbreak in another BPO, God forbid. We see the level of infectiousness of the disease and how quickly it spreads in high concentrated workplaces in closed environments. So though the measure is specifically related to BPOs, I have asked a set of ministers to start looking at their operations and advise as to what other industries and areas would need to have special regulations that meet that criteria. They are in a closed environment, concentrated number of workers, and they are working in close proximity. So there are many businesses like that. I won't call any names or sectors at this point, but you can imagine some of them. And so we are going to be putting in place regulations very quickly. So it would help if businesses self-identify and immediately put in place measures before the government does it. So consider this as notice. We look forward to the reopening of the BPOs, but under different conditions, obviously. We don't want to lose the livelihoods that the BPOs support. But at this time, the health of the nation takes priority. The work from home orders are extended for a further 14 days. So employers have a duty to examine their business process, see what can be done remotely, what can be done at home, and adjust those accordingly. The stay-at-home orders are extended for a further 14 days. And of course, we know what the stay-at-home orders are. If you have no necessary business on the road, stay at home. If you are 70 years and over, stay at home. If you are ill with respiratory or flu-like symptoms, stay at home. If you have nothing to do, Tana your yard, stay at home. But let me clarify, the stay-at-home order has some specific things to it. If you are ill with respiratory symptoms or flu-like symptoms, stay indoors. Isolate yourself from the rest of your household. Make contact with the health services and follow the provisions to get to the health services. Wear your mask, stay away from crowds, try and arrange transportation that will get you for treatment. We have examined the curfews, and as I've said, they have worked very well. But given the phase that we are in and the potential now of community spread, we believe that we have to tighten the curfews. I had kind of relaxed them after Easter, but the cabinet considered it carefully, and on the advice of the security forces and the health considerations from the Ministry of Health, we have some new curfew hours nationally, island-wide. So for the next 14 days, the curfews will start at 6 p.m. and end at 6 a.m. I see Minister Tufton saying 5 because he wants to go and jog at your home. Jog at your home. And this is the challenge. So exercise is a perfectly good activity. But is there a way that the society can reorganize how it exercises without being exposed to a lot of people running up the hill or running around the dam or going to gyms? Is there another way in which we can do it? Is this one of the sacrifices that we would have to make in order not to have the spread of the disease? And this is what we're saying. There is no solution that doesn't require some form of sacrifice. So it is 6 p.m. to 6 a.m. and this will start as of tomorrow for the next 14 days. Now, we have made some adjustments to the curfews as well. Work hours are now adjusted. So work hours are from 8 a.m. to 4 p.m. So curfews are from 6 a.m. to 6 p.m., 8 a.m. to 4 p.m. It means that you have what is called travel time. So travel time is from 6 a.m. to 8 a.m. and from 4 p.m. to 6 p.m. The JUTC and registered PPP taxis, PPV taxis, public passenger vehicles, they are allowed to be on the road from 5 a.m. to 7 p.m. But they must not have any passenger in their cars between 5 a.m. and 6 a.m. and 6 p.m. and 7 p.m. That is their transportation time back to their home. So the JUTC driver, he needs to get that bus back into the depot and find his way home. The taxi man, after he has dropped home the last person, he needs to find his way back home. So I believe that that is very clear and very fair. So we're asking, therefore, that all workplaces make the necessary adjustments. If you are on the exempt list, and we will clarify that tomorrow. So, for example, a power station that has to continue to operate, but it should not necessarily need all its staff. So the staff that is not critical to the operation, that's a 24-hour operation, their duties should end and they should go home by 4 p.m. This measure applies to supermarkets. The supermarkets, however, should close at 5 p.m. The pharmacies should close at 5 p.m. The corner shops should close at 5 p.m. And we're doing that to allow that extra time if you need to drop in and pick something up. We have adjusted the times for markets, and the markets will now, instead of being closed at 2 p.m. and it was Sunday, Monday, Tuesday, and Wednesday, we will now allow the markets to open all week, except on Sunday, up to 4 p.m. So the markets will go from 6 to 4. They will be closed on Sundays. So there will be one day without any market opening at all. Wearing of masks. The wearing of masks is now mandatory in all public places, and that would include passenger vehicles. All public passenger vehicles. I am encouraging all Jamaicans to comply, because we are now in the phase, or the CMO will explain whether or not we are in the phase, but we are close to being in that phase of community spread. The prohibition on gathering continues and will be extended for a further 14 days. No gathering should exceed 10 persons. Social distances, the orders for social distances are modified. We had given 3 feet minimum that people should stay. The minimum is now 6 feet. And these are orders which we intend to enforce. And we are asking all Jamaicans to note that. I know it's hard to stay away from someone. We are people who are used to being close to each other and embracing. But in this epidemic, I urge you to stay 6 feet apart. The exemption lists remain. Tomorrow we will go to Parliament and we will have a review, a debate on these measures so we could make changes to the exemption list. I must say I'm not inclined to see an expansion of the exemption list, but we can certainly clarify the exemption list. For St. Catherine, the measures announced in relation to the borders of St. Catherine remain. So St. Catherine is under a 24-hour curfew, technically. There are exemptions for the exempted list of essential services and essential businesses that can continue to move about, to pursue their duties or to pursue the services that they give to the public. But the days for movement and the time for movement has been adjusted. On Wednesday, so tomorrow, the existing order for St. Catherine will expire. These new measures will take effect on Wednesday. So on Wednesday will be what we call a shopping day. And residents in St. Catherine will be able to move about on the hours of the national curfew. So they will be able to move about from 6 a.m. to 6 p.m. However, the establishments that are permitted to open, which continues from the existing orders, they will open from 8 a.m. to 4 p.m. We have removed the alphabetic classification for movement, so everyone can move around on that day. But put it here this way, if I lived in St. Catherine, I would explore every means possible not to move. I have family that lives in St. Catherine, very close family. Still, my mother lives in St. Catherine. And my advice to her, stay home. And I'm giving all mothers in St. Catherine that advice. Thursday is a stocking day. So after everybody has taken out all the groceries out of the stores, then on Thursday, the stores are not open to the public, but they are open for restocking. So Thursday is a no movement day, except for essential services who are permitted to move. But stores can open for restocking, but they cannot serve the public. Friday and Saturday are shopping days. Same rules apply. You can leave your home at 6 a.m. spend 2 hours getting to where you have to go. 8 a.m. the stores will open, and then by 4 p.m. they will close, and then you spend 2 hours to 6 p.m. getting back home. Sunday is a no movement day, and we will allow restocking. Monday is a shopping day, because after Friday and Saturday, there should be no stocks left. So you have to restock on Sunday, in order that Monday is a shopping day under the same conditions. And then stores can restock if they so choose on Tuesday, but remember, Tuesday would be a no movement day for citizens. These will be published so that all citizens in St. Catherine can understand how this will work. Pharmacies are allowed to remain open throughout the period of the measures. So pharmacies can open from Wednesday to Tuesday. However, on the no movement days, they are only permitted to dispense pharmaceuticals, for good reason. There are many pharmacies that are mini-marts and sell other things other than medicine. It would defeat the purpose. So this is to ensure that persons who are ill can get access to the essentials of life. As I said, there is no perfect solution. We try to come as close as possible to the solution. Bars, amusement places, and the likes remain closed. These orders will be gazetted after debate tomorrow, and they will be published in the usual form. I'm going to ask Minister Johnson Smith to...
The curfew actually starts on the 22nd. He said tomorrow it starts at 6 p.m.
Yes, I will clarify, yes. The new curfew rules, the AG is reminding me, starts on the 22nd. So at, AG, you're saying at 6 p.m. or at 6 a.m. on the 22nd? The new curfew rules, precisely, the new curfew rules, forgive me, starts 6 p.m. on the 22nd. So you have 1 day's notice effectively to the start of the new curfew rules, which would mean that all the other measures under those rules follow, which is the closing times for businesses from 8 a.m. to 4 p.m. and the traveling times for persons in public transportation, and the closing times for stores would start at that point in time. So, ladies and gentlemen, thank you for listening. I'll ask the Minister of Foreign Affairs to give us an update as to our Jamaicans overseas and the measures we are taking to assist them. Minister Johnson Smith.
Thank you, Prime Minister. I know this is a matter of great concern to not only Jamaicans overseas, but to those of us here with not only friends and family who we miss dearly, but just Jamaicans who have a strong sense of our diaspora community and our brothers and sisters who have found themselves in a range of circumstances overseas when they had not intended. And this ranges from persons who were perhaps surprisingly, on vacation and were unable to come back home because of cancellation of flights, to persons who had work arrangements which have, of course, been cancelled or been terminated because of the circumstances globally, to interns whose internships have come to a close and students whose institutions have closed terms, in some cases with residences remaining open for them and in others not so much. Through our embassies, high commissions and consulates across 20 countries, we have done our very best, and in addition with our honorary consuls and our extremely important diaspora community or diaspora associations, been able to identify and provide support. Sometimes it's a conversation and counseling, as has been set up by an excellent team of pastors and counselors in Miami who reach out to our hotel workers and who were discussing how to engage more deeply with a broader set of persons who have found themselves in circumstances where they had not planned to be as a result of the global COVID-19 pandemic. Again, we have sought to ensure that we are able to provide, where possible, accommodation or foods where persons have accommodation provided by employers who are unfortunately not functioning anymore, but trying to assist our nationals because their arrangements have come to a close, as well as, of course, persons who have, through the grace of friendship, family, and community, been able to provide broader support for our nationals, whether it's medication, a safe place to stay, or resources and services. And for this, we are enormously, enormously grateful. We want to say, as Prime Minister said earlier, that we are absolutely in sympathy and empathy and understand the concerns that persons have about our nationals overseas, and also that being experienced by our nationals overseas. And it's true that there are no easy choices in these circumstances. There are only the best possible decisions with the public health of Jamaica in mind. In these circumstances, I know that the public has been broadly debating the
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth